Shikadashne, do Kajahana Sio Gizi, Heha, Ado Kajahata Okiso AD. This evening's town hall, we'd like to welcome each and every one of you. So without further ado, let's go ahead and open up in a prayer. Ado an hien hitodazun the holodog ashe na dansu that the niche na holji yeah shikedoshne kodoshe tsunadi zindole kodan hojole shamana hassan yadelhil zlistan twistan ado chalhil ayol khat na hodetsui halch elti halch ewan na dalke na dalsui khadedin ani Tradedin ani bik a hojon ni yajen na awe ni klon nandi na hodi ani bi a kwije e kodo ni hitren to dilzen don hitren te dilzi ni hitodzen that the yindole a don ni hi no that the yindole a ro kon hit na bel khot ob kha e kon yat e kon hitna hot atole yat an hitna hast adole nas kon ne nije a at kon ne Tilkeja case tuisani ngas tuinizani dan lini yat ehon nada kedole biket aton lebetit aje yat eho hon bejane lini da betski an khanein gladole ado konat ani dan ade hon etelate nat ani no hon shiyaj ado hon shiyaj ado hon shinan lo asla hon yil ina il ini ado ba alchine large case ni na gai ado hon khadaj je Nakaba anna holyando le hon hinat anin lini hon ado hon kebedai kehi it abesh mahasa anat als hon do benashni do le edo hon ya at eko hon nakhan nata ha ado ya at el hon nakhaya nata tit do le ado hon ji da do de quiz kanye da shin kodo khatnas ne len lini als hon ko bel islah nasi lin pero betkhaya at hot eto le Hashine la konta hini trado skit I trado le nasko ne nije be na nit edo le koni hidene pa ntna ne ke so hon bayana ne tito le shaman hasan ado di hindene eta no lini tsada asa ani tsno jashi do la ta isi tsan dan de ni hito ni hitraya ta hot edo le nasko ne nije ado na alchine dan lini ko da iltrat na da huishi jono da istrat dole bedo besna hon lo dole adon na alchini yaja aj do ze bata hazli dole halati konal toiki to kosutsa nas it's ata peti nini ni hits adol to adi ni hits adol to ado khashine la kon khat khali danle ze ben ha gaje adon al sostate I altro بتفهي أخوت دولة آدو بك إجتلي دولة آسفه نخاتو دلزن آكويت آكويت بتو دلزن دن لا دو بيين دن لا دولة ناسكو داديين دولة ياس ناسكو بنكي تخي أنا دهوت دولة آدو كون آسفه دنبا كاهني دلوني آدو هون هي تلات سون هي يجن هي ويت دان ليني إيدو بناشني دولة آدو ألا لانج ديل نشين كون تلادن لتس إيسن دي جاي nda al kahidan la ado ze el ebet nas ango na khatel nishi pero bet khaya khot eto le khashin za go shi binne das tildan le ho ado hon hik edan lini o yu e kodo ho hik en lini ko biket hastin nas go ne ne je asa an si so hom bich khana inni lidon hin se kes na bet ket on na bet si dole o shi yu go bit in tozul zen la nande Ado kon hin kiran has angon hi kon da klon hi konesh kishnas khango ni hit khotnas khango ni tes kenas lago ti ani bi njuno khana dil gito is khado ne ne jo yat e hon na de kredole kon so ga etso de zin lini ho be hanana si dole ati ne ben hi chon hojona asli hojona asli hojona asli hojona asli kon so ga shen so na de zin dole anal zwei ni hit so de zin hollo ko kodo e ya shina Hijahanana Zito Len Hinatani Lini, Honorable Jonathan Nash, Shana, Nana Hodges.
All right. Thank you, Dr. Fowler. Ado Yat Ekan Hidinido this evening. I'm in Sayit, Arizona, not Canyon de Chelly, but right between Shanto and Kayenta. This is the opening to the Sayet Canyons here. This today we were in Navajo Mountain, Hatsasan, Ade, Asitli, Le Soleha Zojia, not Ani, Najat Satagi, Governor Spencer Cox with Yaya, Ako Yugato Satagi, Lieutenant Governor Henderson, A. Asitli, Hatsasan, A. Utah with Hahod Zoya. A le nahatsasan don le oje kin do ni ne to a banda si ti dice ado I pa ni behas ani la benaz niya Navajo Utah Water Rights Settlement Act with a D December 2020 benaz ni ako a na tsospakada liya de ya peso gido I halet ao ya togi naskudo ne jo tosi Unity San Juan River aj pajugo le Utah je the neke tniki tobiche kodo ne no jo banda city not ani Pelagana dan Linigin Lake counties damp city the Commissioner San Juan County Bruce Adams do Willie Gray Eyes Ado Katnazan dan Linigi Navajo Mountain dan Ado Nihatila Day dan Linigi Attorney General Doreen McCall Ado Economic Development J.T. Willie Division of Natural Resources Rudy Shabala Ado Garrett Silversmith Navajo Department of Transportation let's see, so Aden Hisao with Saga Hot Zango, Ako Haska was Kiso Kodo, and then he could no the and the Kosan Skagi, last aids at the last Negi, and the Shigido, the Kitchen, and the Pagido, and the Chiniki Kid and Linigi, and the Shite, Iniki, and the Ha, what and then you to us and daily. Na kijinda anishuna ti do ti jinda anishuna ti na kijinda anisha da aro pin kones na was kisa aro fasitida hasta was kisa hota anan hiche kodelia ti chido hotsa peninagi ti nas nala shla hadas zogo betata siti pinda Monday, Tuesday, Tuesday, Wednesday, Thursday, each a business ni biniyagi ya peso chide aya ne 2020 and cares that alait a peso chose to ni jo ni ashane dalia aro na khabiga to aro dani nasigi di Facebook bi on ya skopan gi so Nahabiga she north Ado Dean any peso Penaz in Washington Atoni Hitch Atoni Hitch Conetta American Rescue Plan Act funds Williego ya cut in a yanta in the heat study net 8 nas developing la no senigi I ta so zi dai ta Nascodon, fish the cheese, the Nascodon, the Agi cellular towers, the Agi internet, Joan Dad, the store that Sito, Otahan and Hijukad, Edo, the Havanda, the Hamasan, the chain, not last, what the pop, nature, Havan Kin, other the no auto todo, sister projects, that Agi, auto Tingo, Josh. Nana eso yanda Washington the Edo journey that is Kia President Joe Biden Vice President Kamala Harris so cut down the Washington the Joe did more at ya Joe Biden son hani ya the never Kia Paka kodola na the nene which Ashane Delia not so which Delia. So the better has that Ishi Hashi, Lodge the Sutagi, the Feva. So Ashi Kudo, and Ninigia, Dr. Joe Biden, Kudo Haleta, which is known, City, Nas, Nigi, Diego, Yakutsa, Did Naviki Apakao, Aquashe, Kudo Naha, here, Pedini, Do, Paistan, Hichedi, Nab, Hot Abacha, City, as Ani, Don, De Washington, then Hitchington is there, because still contact the car, Aro, Yedago, Yadat here has come, Casalanza, Dobana, Yadat here, and that do, Hello, wish to, you know, the Kara, hand sanitizers that, Egg that, Aro Hagan, then that's all. Ja, Ede. Nasto ede tadi nitasi ni ako ikpikit na initial tadi na snigi ebili na panda huine ako the DJ yakodo yades kido nike ada ostaba he ni skashi laje na tanin linigi Washington da sadagidi bakagish kiji it's Ispa Hayaji Kidez Igi, Director Elizabeth Fowler, Abiti Sahit Leto Leti, not Kidigibi. So Ashi Kodo Hanebich Kodel Neto Let. So Zishi so the neck etcher, so Kache Belagana actually has Sito Let. You know, I'm in Canyon today, coming to you live. We were in Navajo Mountain. We met with the Lieutenant Governor, Deidre Henderson. I'm sorry, Henderson. And she came from Salt Lake to visit Navajo Mountain. So she might be driving through. We kind of took a shortcut. Those of you that know Navajo Mountain up at Paiute Mesa, we took 6310 back way to Navajo National Monument into Shanto. While the rest, everybody went all the way around Inscription House and Shanto Market and back this way. So they'll probably be driving through any minute now. But anyway, we had a meeting about Navajo Utah Water Rights Settlement Act. You know, we need water there. It got approved. We're just starting the planning process to get water infrastructure to the Navajo people in the state of Utah, in the Navajo Nation side. And then we also talked to her about the road that's going to go from Navajo Mountain to Old Jato. You know, that's been ongoing for some time now, a long time. And so we are focusing on that. And so I stopped. We're on our way back to Window Rock. We stopped here to do this segment just to give you an update. And today, ladies and gentlemen, we are reporting to you all 6 cases, daily case count in 24 hours, 6 new cases of COVID-19, 3 deaths. Again, some prayers go out to our Navajo people. You got to stay the course, ladies and gentlemen, stay the course. Yesterday, we had 15 cases, but 0 deaths. Tuesday, we had 0 cases and 0 deaths again. We've been in an all-time low. I'm going to kind of focus on this part before I turn it over to Dr. Jill Jim, and then also back to Dr. Fowler. Captain Brian Johnson from the Indian Health Services is on as well. And I think the other ones have logged on as well, maybe Dr. Burridge and others. But overall, 247,165 doses have come to the Navajo Nation. It goes these healthcare facilities in and around the Navajo Nation. When I say around the Navajo Nation, that's like Winslow Indian Healthcare, Utah Navajo Health System, Gallup Indian Medical Center, Naka and Flagstaff. See, these are healthcare facilities off, but majority of them are used by Navajo Nation. 223,065 of those doses have been given to our Navajo people. That's 90.2% of what we receive here on the Navajo Nation have been given, put into the arms of our Navajo people. Ladies and gentlemen, we're almost at 100,000. We're almost 100,000 fully vaccinated. So we're getting close to community immunity. I think that's what IHS says. But 98,287 of our Navajo people are fully vaccinated. Why do I say that? That gets us closer to community immunity so that we can get to open back up to our visitors. Now, I'm going to give you some numbers here. Try not to get lost. I kind of got lost when I was giving this update. But, all right. Of all the healthcare facilities, Gallivinia Medical Center, Shiprock, Tubisi, all these healthcare facilities around the Navajo Nation, on the Navajo Nation, there's a thing called user population. That means this is the amount of people that use these facilities on and around the Navajo Nation. 240,323 charts, if you want to call it that. And that was in 2019. We haven't get an update yet. So 240,323 people have charts for these healthcare facilities, right? So those are people living on the nation and people living off the nation that come home to go to these healthcare facilities. Remember, 16 and under are not getting vaccinated, right? So that's about 25% of this 240 plus thousand. So if you subtract the 16 and under, the adult population that have charts is about 180,242. All right, stay with me. So that means those are the people that will be able to get the vaccine. All right. So I said 95,000 plus have gotten fully vaccinated. So if we do the math, that's 53.1%. 53.1%. Over half of those that use the healthcare facilities in and around the Navajo Nation have been fully vaccinated. 2 shots or 1 shot of Johnson & Johnson. About 4,000 of our people got Johnson & Johnson. All right. So that includes people off the nation coming back on. Okay, I'm going to give you another statistic here. What about Navajo residents? People living on the Navajo Nation. We did some data on that. We put some numbers. We found out that 175,000 people live on the Navajo Nation that use the healthcare facilities. That's not counting people off the nation, right? 175,000. So 16 and under, if we took out 25% of the younger 16 and under, that leaves us with 131,250 people, adult population that live on the Navajo Nation. All right? 131,000 actually living on the Navajo Nation. Now, those that have been fully vaccinated on the Navajo Nation, that actually live on the Navajo Nation, 72.9% of our Navajo citizen adult population, remember 16 and under, they can't get their shots. That means 72.9% of our residents have received both shots or 1 shot of J&J, Johnson & Johnson. So ladies and gentlemen, I want to do a challenge. And it's still up to you. We haven't get everybody vaccinated. But if we can get to 75% of our residents vaccinated, I think we can start moving into reopening the Navajo Nation to our visitors. Because as they said, 70 to 80% is herd immunity anywhere. So we're right in that range. There's always got to be a goal. And I think if we can get to 75% of our Navajo residents, again, people living on the Navajo Nation to get fully vaccinated, we can consider reopening our nation. So total adult population that has been totally vaccinated is 95,769. That's a great achievement. And that's what First Lady of the United States of America said to us. You Navajo people are doing an outstanding job. You know, I'm just the face of the Navajo people because I'm your president, But I want to say to each and every one of you, good job. Thank you. Listening to our public health professionals, our scientists, our leaders, and that is how we've been successful. And people are looking at us and wondering how Navajo did it. And all I say is the Navajo people did it. They listened. They didn't say that masks are a political statement. It's about others. It's about our family members. It's about our community. It's about our nation. And I appreciate everyone wearing your masks throughout the Navajo Nation. And, you know, we were on NIHB, and, you know, the Navajo people, they gave us an award. The national, only one person, one group gets this National Native Public Health Innovation Award from the Navajo Indian Health NIHB. And it's because of your awesome efforts. Nationally, we were picked because of what you all done. And they gave it to me, but I acknowledge the hard work that you all, so I accepted it on behalf of the Navajo people. And so that's great. We got an award for nationally on what we done here on the Navajo Nation. But we can't let up. We can't stop. Let's continue to wear our masks, social distance, and do what we've been doing to keep these numbers down. So I just wanted to give you some good news. I know we haven't had some good news in some time. These little blocks here. And so we are on our way back to Window Rock. Congratulations, everybody. I appreciate the hard work and the prayers. The prayers, the Creator, God, is looking at us favorably. And it's because of everyone praying for the Navajo citizens and praying for this virus to go away. Continue to pray each and every day, ladies and gentlemen. So thank you so much. I'm coming to you live from Sayit, Arizona, between Kayenta and Shanto. Beautiful backdrop here. Making our way back to Window Rock. So I'm going to turn the time over to Dr. Jill Jim. Appreciate everyone and your hard work, including the great team, Navajo Department of Health, the Epidemiology Center, the HCOC, the UCG, everybody that's on this call have done an outstanding job for everyone, not just the Navajo people, for everyone. Because if we keep the numbers down, then the virus doesn't spread off. So thank you so much, Dr. Jill Jim. I'll turn the time over to you. God bless you. God bless the great Navajo Nation, everyone.
Oh, yeah, non chinot ani kwadi. Nija hananin zegi kwadi. Kwashi on you on Sunya that Holianly not just on the things that she others are there on our shadow kwadi. Probably drove by my grandmother's house and relatives out there, and it's a beautiful area. And I'm glad that you were able to meet with individuals out there to discuss very important things that you guys have been working on for a number of years. So, the Public Health Award, that's a large accomplishment, President. I know with the Unified Command Group, we have Captain Johnson on the call as well, and several of the tribal health organizations. We have been working with you, along your side of you, and along all of our people every single day since we first heard of this disease called COVID-19. Hanzashin Holjati Quatin hidden napping, and so Ashin Bihati Kahashit, and so a Hada any Nedano Doshi or Hadabik eho at that deal Niltog a chain his bells and the hate are the Kosan Sagi don't kid the dog not that the needs no a quadi he chinked on his biggest Theodore it's on and that's so no it's a yadal Theodore. Send what on in his on his chief guest get that neto do ado yego when not go alkene kahota di ne do alt indigo a or the do kadi aha want the alt indigo da di ne ado an hilot kanda kisto kadi on da kego do at the hot in da di ne so ashi what on hit yat the the I'm usually reminded yeah teaching him Lena she quite anyone nika hot no she puts on that quishi Nache is lean that she but not and can she quite think better husband a sheep and not quite the no so she quite and his chin and then you can no she is thought there yeah so the quite the aber Hansen quite the get the episode that you did the so the she should not on the quite the by Hansen the quite the award the Navy a you deserve it president and we are here all along with you and have been working with you. So it's also an award of the Navajo people. So I hope that we all are applauding ourselves because we are an example for others. And we are beginning to talk about the work that we've all done and we are leading the way in the pandemic. But we also know that we've come a long ways with the number of fatalities. We've lost a lot of relatives. I think that we have a long way to heal. Ayoshi bete bata needs and we take prevention very important because we know of the amount of lost lives we've experienced. So, and that brings us hope is that we can overcome this disease by doing a lot of these health professionals giving us recommendations and providing the messaging. So I just wanted to share how are you guys doing this, and really goes back to the significance of our language and our identity. Asian ben nachit kwadi het on hit see yeah the halong do hit our cost the halong she kwadi but it brings us happiness and AC those are some things that I boarding school those were things that we wanted to always prevent was lice so and so those are all ways to just remember that the prevention of COVID is really a lifetime or long-term habit that we have to adopt to, and it will probably stay a normal routine for us now, and that's what is very important, that it's not really something that's a struggle to forget. It becomes something natural to us to have these things, and having gloves in our vehicles so that when we pump the gas for our vehicle, we have gloves. So all of those are very important things. I just want to remind people that we're all probably practicing those, and it has become to some sort of normalcy. And those are good ways to just know that we're listening and we're adopting to preventing COVID every single day. And that has brought us to this yellow phase as well. And the yellow phase, we have several lifting a lot of restrictions. We have actually some numbers that have increased just recently due to some small clusters, but we're going to remain in yellow unless if there's going to be a long sustained rebound. And so, like for examples, we weren't able to do indoor dining. So I hope their individuals are accessing indoor dining since it's allowed. And also just to remind individuals to still practice a lot of these prevention. And other areas that we have looked at is opening casinos are still open, and parks, tribal parks and lakes and fishing. And the zoo is now accessible to Navajo Nation residents and any of the citizens, and also employees that work on the Navajo Nation. So I hope that people enjoy these new ways to access the outdoors safely, and just keeping in mind that we will continue to monitor to numbers, making sure there are no large sustained increases. But in the meantime, there are some fluctuations, but we're all doing a good job with keeping the numbers down, even though we might see some small spikes here and there. The other thing that President mentioned is also just the importance, and every healthcare provider and every other person in the community is going to talk about just the vaccine, getting a vaccine. We all are doing a good job by getting fully vaccinated, but we also now are dealing with the J&J vaccine that was halted for a while, but and it is now resumed. But we just want to make sure that people are understanding that the Pfizer and Moderna vaccine are still safe, and not to be really combined with the J&J. So I know our healthcare providers are going to need to do extra work to provide education to everybody. And so it was very limited. As you know, there was only 6 individuals out of millions of doses that were administered. But as they did the assessment and reviewed the risk of the vaccine, they deemed it as not really high risk. So there are processes in place. So there's a flyer on here that will, I hope it's available on the Navajo Department of Health, but it is on the Facebook page. Kind of explains where to call if you experience symptoms, and also just the benefit of getting 1 dose versus 2 doses is still important, and only certain individuals are at risk as well. But there are some guidance here for those who would want more education, but I just wanted to reiterate that. Another thing that we're also finding out is our healthcare providers all do a good job, but we're also learning there are still individuals not getting enough vaccines, and I think we need to find out ways to make them aware that that vaccines are actually less taken by younger individuals. So those of you who are 16 years old or 18-year-old, please know that it would be good to get everyone vaccinated so that we don't experience any outbreaks. So we are experiencing outbreaks, and some of those are among those that are not vaccinated. So the vaccine does work. So just make sure that if you're a grandma or an auntie or an uncle listening, if you could relay that message to the younger folks that you have, your nieces or your nephews. So it's to protect the elders, anybody here on the reservation, their own household. So we're really relying on you guys to help us, because sometimes they might not come to the facility and think they would want to get consultation or ask questions. So I'm encouraging those of you listening to help message that they can ask questions and get information to get vaccinated. So, and just know that we are going to try our best to continue this sort of messaging, but we need help from you guys. Also, we know that the variants are still here, and we have identified a number of variants, but I believe in some cases, due to the vaccine, we're not seeing large outbreaks for these reasons. So just letting you know that we monitor and we do surveillance. And at one point, we are very cautious, and we are very cognizant of the way these variants can be transmittable. But at the same time, we're also letting everyone know that still continue to take all the precautions that you need to, and knowing that the variants could easily spread, but it really hasn't to some extent. So just know that it is working, but it doesn't mean you should let down, as President mentioned. And that means wearing your mask properly and making sure you have a tight-fitted mask as well, and covering your entire face and making sure your mask is not underneath your mouth as well. Also, the gathering limits in the new public health order does allow for the 15 persons or less. We increased it by 5 persons, and also 50 vehicles are allowed to gather. And so even though if you're allowed to gather, continue to make sure you take all the precautions that you need. We understand that CDC, we thank them for their guidance and also their leadership in providing recommendations to states, territories, and tribal communities. But for us here on Navajo, we want to continue to wear a mask, either if you're vaccinated or not. I believe that we have not have enough evidence on our end, but we know that people take precautions. And that means graduation guidelines. We are working on these guidelines for schools to safely gather and graduate their children and their kids and their relatives, but we know it's still going to look different. I mean, we're not going to have a full football field filled with individuals. Just know there's going to be still limited recommendations on this, so just know that we're working on it, but we are having discussions about what would be the safe limits that we would have. But at any time, if you are at a school or at a place of business, or you work there, or you are a customer, you are always welcome to report to the Navajo Department of Health portal to report cases so that we can look into it, make sure people are isolated or quarantined, or either making sure they follow safety protocols as well. So we just always, you are the ears and eyes of the Health Command Center as well. You are a partner and into this response, as we also rely on you guys as well. Also, another thing is the mental health and relieving stress, and we might also have this new anxiety that we're in the yellow phase, and we all, for me, I'm also experiencing that, and we've been sheltered up in some place. It doesn't mean we are fearful to take off our masks, but it's just the experience of doing something different that we haven't done, and maybe that's something that I need to overcome. But I know it's like, yes, it's quite normal. You can go fish, or you can go somewhere and hike, or you can access services more longer than we used to. So I think that it's just getting used to something different that we haven't, but it's because of all of us that have contributed to the hard work. But a lot of that, if you're dealing with stress and that, you can try to take care of your health, eat healthy, exercise, avoid alcohol, talk to someone about it, and through phones or Zoom. And I think we've all maybe have gotten used to that, but I just encourage everyone to still try to risk doing less transmission of COVID interaction in large groups. And if you want to visit with your family, make sure they're in small groups and not large groups. Make sure everyone wears a mask as well. And the one thing that's really interesting that you hear from our relatives is they actually ask about, some families I've heard ask that if you're vaccinated, you're more than welcome to attend to our small gatherings. So individuals are keeping track of ways to make sure that they have a safe gathering. But the most important thing is the safest place is at home, and always protect our fire at home, our children, and our livelihood is always at home. So so I wanted just to encourage everyone to just continue to take all the precautions, and we are definitely all a player in all of what's going on here. And I know that I wanted to show a video about vaccine. I'm not sure if it's going to work. I can attempt at it, and then we'll see if it's able to share. And it might not share. And let me see if I can share this video, because I wanted to I wanted everyone to see this so that we could kind of get an idea of where we can support people getting vaccinated. Okay, it might not be working, so I'm going to stop video. So there's a link on our webpage, so let me go ahead and stop this. So it's not working, but there's a link here we can share on our Facebook page. It's a video about our Muslim talking about vaccine uptake, so you're more than welcome to go on our webpage so you can access the Facebook. So attempted at this new technology, we still haven't had it down, so otherwise I'm going to go ahead and introduce Captain Johnson. He's with the Navajo area office, so take it away, Captain Johnson.
Hey, thank you, Dr. Jim. I appreciate it. And maybe we will get that video going. It looked like an interesting video, just didn't have the volume. So sounds like a great idea. Hey, everyone. This is Captain Brian Johnson with the Navajo Area Indian Health Service. I serve as the acting Deputy Area Director in St. Michael's, Arizona. And it's nice to be here with you in the evening hours on this beautiful Thursday evening, and I was a little bit jealous of President Nez up in the Sayee Canyon area. Looked like a nice evening there as well. So safe travels to him as he drives back towards Window Rock, assuming he's doing that this evening. And I want to thank he and Dr. Jim for continuing the sharing of information concerning COVID-19. And I hope people across the nation are listening in and on Facebook Live this evening. This is certainly, as I mentioned earlier about the weather, this is at least my, I think my favorite time of the year when we hit the early springtime, mid-spring. And I know that recently we've had some experiences with high winds, and which is oftentimes not that pleasant, but today was a beautiful, certainly been a beautiful day. I had the opportunity to be out in the Crown Point area today visiting the hospital, and I want to say thank you to the Crown Point staff, very welcoming, and had the opportunity to tour the facility again, meet with staff, talk with the leadership, and appreciated that. And congratulations, as was reported here earlier, to the Navajo Nation, to the Navajo Nation people, to the leadership of the Navajo Nation for the National Indian Health Board, the National Award to the Navajo Nation concerning the COVID-19 response, and just all the great work that's gone on here. And again, we all know that the COVID-19 epidemic was certainly one of the biggest challenges possibly of all of us in terms of our lifetimes, in terms of public health crises. But I'm just amazed and very proud of the people that I've worked with. I'm proud to know everyone and to have participated in doing the best we could in addressing this COVID-19 pandemic. So again, congratulations. It's nice to hear folks get recognized, and President Nez was able to represent the Navajo people, which is wonderful. Also, as was reported earlier, it's a good day because we only had 6 reported cases today of COVID-19, and if we can keep the number of cases, or sometimes we refer to it as the incidence of COVID-19, the daily incidence, that's a great thing. And that number speaks to the work that people continue to do across Navajo Nation in terms of preventing COVID-19 transmission or spread to one another. So again, great work going on. I'm really happy to know that people out across Navajo land are not only looking out for themselves and thinking of themselves, but also thinking of others. And what I mean by is wearing the mask, also continuing to wash our hands, and distance from one another, and also particularly with the vaccinations. That's been a tremendous success here on the Navajo Nation. So thank you all for that. Of course, I know that it's been discussed here this evening that the number of COVID cases are for the most part continuing to remain low. We have had a few days here and there where the number has jumped up, and it's one of those things that we have to really take notice of, because when we see those numbers jump up a bit, what can we do to prevent that from happening? Because that's how the disease continues to spread or transmit, is when we have those increased numbers. And we know that at least more recently, that some of those numbers were as a result of group settings, and so that really emphasizes the importance of keeping the number in a group down, as Dr. Jim had mentioned, with the emergency public health order, and keeping the number down to 15 or below in terms of group size, very, very important. I just want to mention again, and I always like to, just make some comments about some of the ongoing work that has continued. And, again, we realize that the number of cases are down. However, we also want to let folks know, and just to remind folks, that all of our facilities across the Navajo healthcare system, again, we have both tribal and federally managed healthcare facilities, but they all come together and work as a team in terms of providing patient care. And COVID-19 testing does continue. If anybody out there listening runs into a situation where they're wondering or they're unsure, maybe you think, well, I'm experiencing some type of allergic or condition or allergies, but I'm not sure if it's an allergy or if it's COVID related. It's not to worry. You can still be tested at any of our facilities, and I do suggest maybe calling ahead if you want to do that. And it's so important that we continue to do that, because with the testing, that tells us where the virus is on the nation and how it's doing in terms of transmission or spread. And the quicker that we know when it is spreading, the quicker our contact tracers can get on top of that and notify individuals and talk with folks, provide guidance on isolation and those kind of things. And so very, very important, but certainly don't hesitate. And I do recommend making a phone call to your local facility if you even think that you might be COVID positive or have been exposed, and they can give you instruction on how to get tested. And we will continue to test for the foreseeable future. It's not something that's going to stop. We think that everyone is important, and it's very important that folks have access to testing, that you know where you can go, and so we can really monitor this thing. I also just wanted earlier, President Nez had mentioned some of the information about community immunity, and we always like to remind people we're still fighting towards getting to a place of community immunity, meaning we have to hit a certain percentage of individuals being vaccinated on the Navajo Nation in order to reach a level of community immunity. And once we reach that level, we'll be able to, it'll protect ourselves, it'll protect our family, it'll protect our elders and others around who you may frequent around, such as colleagues, just co-workers, or just friends. And it's important that we continue down that path. And we know that we've got a significant rate of full individuals who are fully vaccinated here on the Navajo Nation, but we can continue to do better. We can continue to increase those numbers. And by increasing those numbers of fully vaccinated people, that's going to even protect us more, no matter where we are on the Navajo Nation. And as President Nez commented on, if we're looking to reopen, businesses more fully, then it's so important that we have more and more individuals continue to get vaccinated. Now, if we have individuals out there who are still concerned about vaccines, I just want to say that with we have 3 different vaccines, as has been discussed. Moderna vaccine, there's Pfizer vaccine, and of course Johnson & Johnson. And we've been open with the public and transparent. There was recently some concerns about the Johnson & Johnson vaccine that came about due to basically 6 individuals or 6 cases of a situation involving blood clots. However, that was the Johnson & Johnson vaccine was halted in terms of administering that to individuals. And it was looked at, it was studied, and it was found that we should continue with our Johnson & Johnson vaccines. And so we have done that, and we're continuing on. So again, we have 3 different varieties of vaccine, and we just encourage individuals who may have not received their vaccine yet to certainly go to your local facility, make a phone call or 2, and they can schedule you in. And there are still vaccine clinics that are happening around the Navajo Nation, and there are schedules that are sent out. And so if you contact your facility, if you look in the newspaper, if you look on the Office of President and Vice President Facebook site, you can find those vaccine schedules that are happening. Some of those happen Monday through Friday at the various health clinics around the Navajo Nation. Some of them happen on the weekends, and some of them are by appointment, while others allow you to walk in. And so that's why it's important to contact your local health facility so they can provide the best information to make it most easy for you in terms of getting your vaccination. Again, just want to make a comment that we're continue to be excited about funding that we're receiving from the American Rescue Plan Act, and we're continuing to work with our tribal partners and making sure that any funding that we receive, that the Indian Health Service is getting that funding out. And we're so very fortunate to have that additional funding. In terms of the Indian Health Service nationally, over $4.3 billion in new funding and resources recently was approved. And so that is being shared with areas similar to the Navajo Area Indian Health Service. There are a total of 12 areas around the United States within the Indian Health Service. And although that money is funded through the Indian Health Service, we also have our tribal partners that receive that funding as well. So we make sure that we disperse that appropriately. So again, there's funding for diagnosing and monitoring and mitigating or doing working in the communities to stop the infections. There's funding for additional healthcare services, telehealth services, and on and on. So again, really excited about that. I just want to take a moment as well to stop, and I realize this is just a little bit early in the week to come, but I just want to make sure people know that the 2021 National Nurses Week begins on May 6th. Actually, May 6th is National Nurses Day. However, May 6th through the 12th is National Nurses Week. And the reason I wanted to mention this a little bit early is I wanted folks to write down those dates, again, May 6th through the 12th. And I want to challenge everyone, whether you're on Facebook Live here, if you're hearing this on local radio, I want you to think of individuals that you know that are in the nursing field. And these might be public health nurses, these might be clinical nurses, they may work in a hospital or a clinic, maybe they're doing vaccination clinics and assisting with that. But I just want to challenge you to think of as many individuals as you can, and either in person or through a note, just send them a thank you. I've worked, and I'm fortunate to work with a lot of nurses around the Navajo Area Indian Health Service, and with our tribal partners, I've been able to meet lots of them. And it's amazing to me what we have out there in terms of our nurses and the support that they provide in terms of patient care. So please take the time. One thing that I've learned over time is that just some kind words about the work that they've done is so important to these nurses across the Navajo Nation. So please do that. In terms of prevention, I just want to continue to recommend that we all follow the steps of wearing our masks, of washing our hands, of distancing from one another. And again, realizing that we are starting to open a little bit more in terms of lessening the restrictions. Also, that home is the safest place to be. And by staying home more often than not, you'll be able to continue to stop the spread of the virus. So I'm going to stop there, and I'm going to turn the time over to Dr. Fowler. I always appreciate her comments and her interpretation from English to Navajo. And thank you, Dr. Fowler. Appreciate you being with us.
Thank you, Captain Johnson. And thank you to all the listeners out there. Appreciate your time and tuning in. Again, my name is Perphelia Fowler. I am the Division Director for Human Resources. And it's an honor to speak to you every Tuesdays, Thursdays, and anytime we schedule some of these meetings, you're there. And I want to thank all our listeners throughout the United States. We get a lot of listeners, even from our militaries, servicemen and women. Although our Vice President, Lizer, is not able to join us this evening, but he'll join us next week again as well. Again, thank you. Shay Kodo Shit my dishkish inchla, other Torichini, Bashichin, Kapaha Edishe, other Ashetationale, Do Atinan Setaro, Asa Setana, Shichito, Shizeta, but that is Balda, Ado. Oh, you go, Nankines, Tado, Behes Ani, the OU, Hatadiliado, Hatadilna Afansi Kai. Do Atilapani, Kadobik Arnold, any Ikihajic Edoshne, Ado di con the question tabadi, Nini Nardoigi, at the Otsiso Honal, the Ado, Chostoit Inihland or Nilpedi, ne variant. Edo at the conhinao nalto ena beta aholian hidine. Ado is the atonaha el nahito is the nahata dodni. Ado at el ha ado onza Johnson and Johnson de nini nakwalian de ado at belana asli koyego deshno at a Pfizer do Moderna do Johnson and Johnson. A company na you go yenan hines tant de snein tron yin nicht that yes yin hinne you go to da ado da in the da ado chin da ke ado hilik at the snitan hit no tron na isna ye go na isna ekodoni de che ye hadzi had shin to ich case a kosani a money tlini honit Hadash hot edo hashin za hot edo lefty no anlede fancy kiss. Ako ane da isenol ta ido nichiln dash nishido ichiln dale nishinat ani notlini amma a jek ebed like eight that she yash shinada dan hitishnis silida ado shata shamada shinada dan hitishne niheha inchno in hitishne Kodon hinat ani in Haihata inosnen hisne, Shay Kodo hon what the ani hon wado ahon the starter, Toshi Kate ho ahon the starter, o ahasa do etahasiza, Jo Quante, Diego Naho Hutza on the Hena da il Tito. Ado you go nankines, it taught us a lot of terms. ako ya hal when nach ya da za hashwye do le no ha shi la yugo بايتاسيل تي آدو آنلي إزا الإيجي إزا الإندان لني نيكي كايجي دوشي إخوتني دانت دوشي إخوت وجي دانت انت جو نانكينيز تخا دشندو دو باشت أدنيت دانت إكو COVID-19 وسيا آدو دنك أجوش إخيت آدو سأسيو إتابدينو خد خالي دان ليني هستوي ساني دا the question sanas et atta dot epigelia ado chostoitini chostochopa ita o yugos as yugon da sikis ado appellate the pushing the nen leaning hits negis la the ne leo the ne attenila dojos trata dan hit on needle dan hit it nestra a question is to is zinte jo ebenina ya kwato ben hisin ta hui nehiki jo sato pa akonosendo yi bahatzet jo et alna kwa ebenache apa hui na ado PPE da ado de ni jaha da bata hui ado quarantine it is nicht that no manasi sad all you is ado shelter in place at dolya that's ato sapata will ata ado CDC the ayis ande ishi dolya a kondeshik edo shne o you go yenan hines ha akko khodo kohot ahigi do nihis kohot zage edo ba hensen dante jo Betado ohos ado o yuna ntin bi salado nti kes haleit an hit the nandihe nihe zani na hasui nihe tilke jikain lini yiket o tin hala shop the nozi naka eye go na ntkim ala slate khos khanne neha no ye gon hitga bendi dan hit eshish ala slada khos khanen o she yo khos na han net do dan hit no adon hilla khata kis an do ta chitin de na halota ot a ben hit khata is zi do ben hit ata athi akonda ajo sata ahash kejko ya athi o bikish iti adon hizad lini do ilne shik edo shne do adesne akosla shi ani beta hosa o la gente ni ado bentan hit nestra dan de pohos naten le na tasi edo bala ashla e bit la hot ahi bala kana na kailijini bena da so aj ni hizabtan jone ado yita hos ni hish e khanit ba yata nitzen ni hin hizad ni helpehosen o yugo chose in do behones na na oyo sata pa shishkela biketo ti ado dik at ni hil akot jo afon hitne ni hitchito ni ze betata des balona khe na te DCDC ta ni do sate na ta ni ta ni ek at na ho also stan hilna ket da khetan hilne ni he kodon hinat ani don hize ke ze it en etan hilno sho ado eta en etsa ye go na ho il to tan hilne. So continue to wear your mask, wash your hands, use the 6 feet apart distance. Ado quad yat entas jida don nasko net yat eho ni he hanat ato ni he jindo ni he nat ato juno ne katna to lecho sato di spring cleaning desne hagam benasht at the hajus ado ti akwijo ni he manna hasan ti no yatel ti no sota dilsen edo pa hosia zilzen ta hosla isten ta nito na ho ta ado onle ta pakho o yo an hit na ho ta ho ke pa ho no sen sa to ya tahi a ko pa ho sia to zilze Ako het ize bajo je kwache jos ito ako na je husto li ado a ol husto otata hostide eja ishin pi ito tla ishin chos ide to pues ilni da la to la pasta ilni da tan ni kolla asta jo o yugo na antino ta asta ado kodonas na de jeti la o yugo a anda ne shik edo shidne o yo apa has ki ye ente Japan hilta hajjah andal nahi akoti business wal yani di lit sobi dati khegi jo pa he nitsen nihit la to da tin shik edo shidna kodon hinat ani inne na kha he nitsen ani sko ik etahonos ini he nza go na khedo yu go ik etahonos annas go ta ik etahonos ido hajor che ata khio Adoti saho a andalia parks da a andalia jo ni hittenei sepatole adon nate belakana that si istlis da sate na tasi o huite senso se a hallo tapeti ne adoti ol na raj ajdo na khapa hanasen na galchinen hi yajin hi awe lini Slapedach, a slapedach, hedonle, Shlaata pedach, ahobat, ato zebahaleta, ado atinalka. Adshi kote holjishnle, ya ishtash chila aj datsin datina kitsa atato, Shlaata pedach, ze a kopata kato tinihitni. Jo a de bahazio ihedole, nana en achinin hi yaje. Ado kwanda hashi di kwa jota jor kitil ni do jor italita yenda na o tato tati nina aj beket nasi zila ako ani hi amma aja no lini hajo ban so kes wa ewe yojo no she sho sa aho wado do le kwat o ni di kwa ba desi Koden hinat ani in hitini nle de queen desert shina khayeta virtual learning adi tsintlış apin sekesi out da ultra ole na achne ni hitnon yen hitchen khazi nat ani en le nasa ishin khayon on ot ahachn hatotze so in English when a leader tells you we're going to stay with virtual learning that's a lot of high level expectation. As a former educator, when our president indicated that, boy, that my expectation go higher, I got to get myself upgraded and updated to today's technology and embrace it. I'm going to have to challenge myself to embrace today's technology because technology changes almost like every month Nakaalchin aita o yugo ye the Hassan Chukwaje Bekeje Bachin Shalchin and Lini or Troye the Hassan Shishala ye the Hassan go ade go yen dashin tin. So when we're told to continue to go virtual as educators, that expectation went a little bit higher. That means we got to embrace it. And I don't think we're going to go back to the norm in the school setting. Auto free scholarship that I know can help can dash khan hitoli o kodi is not kino that so o you non nistat to Jot an kes a majilno a masanjilno ot ye gon kes Asian athletes nes twido sani di de son solieni bi ito ka o shi yugo ben an tinchik edo shidne ado di jiyan but na has ango a andalia o you at yugo ne ka adet eta ita ajendal nishi ashkon shi edo shide bahan nosen ajido na ani da holo jiyan ke ka edo bichin chilahi edo ba ko nosen do ba ko ki ado ana let di bichya da tie ado peso jindal nishi banks jindal nishi edo ahote da dinosen gas station gondal nishi de chiyanji ni honde ehe da betonne ado tsala da konha atahalia يهاخد التهوتا آج خاخليانيكي شيء تو يهبش توني آشي إني تو لا أسيل زتا تو آدو تلا لا تأويني تزيل نخاخليا تو باخا نصن آدو نهتس إسن لني باخوليا شكيرو شدنا أني يني تو جنا ينهين صدا نهينا تاد نهت صدا زندهلا hat so de zenedo algeten gerada shit not asia shit ben shit nestan ni hit auch not nidi o yunan tin ketnas hala di mental health lini ni het den aja is es in et si ra et is na raja yet ani do at ene la kondal nicht aber da hoye on zagot eben yende kret Ado kodom zago ben kehot olsi John Hitlin hinat ani Ada yehatan hisit haleit atas in lati tenne na be khoshin hit o nido ben kehot olsi din hilek ol yashik edo shidne ehe ni hilato dat ado nat ani no lini ano to ehe etselate nat ani no lini kodon hildash nishin hido ehe ni tasil sind quite quiz kanye da shin da da hil sa quite kel greden hinat ani lini bichon na khane ya sa na khe ado da hit en den dan da hil sa shi ke da hiti ne ze da jot shit la nan de jo ado date zada ko kwan man hasan lini ba akhosnya Adon hizaba holia jo keto nido jo sa belche yati yat ego nati kato yat nani keto le ado to da dosini ihe shikedo shidne kon sagoshin kodo nane yado le zeil en dan line la IC benan nishta holla dicha ado la nikinane zara ako nada mo zni oshin ko kodoe ta hosιando ashi ini amape ni pichna hol jish o anila nihimata hollo nihimape benta asti ado hashine la nihima do hitsa bike ta hasti konde nihije do kon nihije bi ko hollo ko ta ado kon do shin tenda kon ta to ko ta jo shin be kha inus ni do le shikedo shne a kohon so do le do yo tan hini nini bin na chata ni hiche kha dates ado ta hofia kon so go shin ko je nada iliado le shikedo shne ta hofia do yo ta hino ne